Hello, I'm Alissa Dell. I'm the stroke coordinator here at Skyridge Medical Center. I'm here today in one of our trauma bays of the emergency department. As you know, Skyridge is fortunate to have 24/7 access to neurologists through our telemedicine technology. It's my pleasure to announce that Skyridge Medical Center will now be offering another advanced treatment protocol for stroke 24/7. It's called intra-arterial thrombectomy. This is the surgical removal of a blood clot in the brain caused by a stroke. We're the only hospital in the Southeast Metro Denver area to offer this in-depth care to our community. So let's take a step back and talk about the devastating effects of stroke. Nearly 800,000 people in the United States have a stroke every year, the majority of which are caused by a blood clot in a part of the brain. Unfortunately, stroke's the number 5 cause of death in the US, killing nearly 130,000 Americans every year. That's why our mantra is always going to be know the signs and symptoms and call 911, because time is brain. 87% of strokes occur when blood vessels to the brain become narrow or clogged with fatty deposits or a blood clot, which cuts off the blood flow to the brain. This is called an ischemic stroke. High blood pressure is often one of the most important risk factors that we can change. So I have a few images that I'd like to demonstrate what happens in the brain during a stroke. When we look at the vasculature of the brain, you have 2 arteries that come up at the front of the neck, which are the carotid arteries, and they supply the anterior circulation. There's 2 that come up the back, which are the vertebral arteries. When you have a blockage of blood flow to an area of the brain, then you're going to have symptoms that correlate to a part of the body that is responsible for that part. When we look at that anterior circulation, that's going to be fast. So face, arm, speech, and time. The posterior circulation is going to be responsible for balance and vision. When we look a little bit more closely, here's an angiogram of the vessels, and you have the carotid artery that splits off into the middle cerebral artery and the anterior cerebral artery. The middle cerebral artery is the most common place for you to have a stroke. The posterior circulation has the vertebral artery that comes up into the basilar and the posterior cerebral artery. So you can see when you have a blockage of blood flow, then you'll have correlating symptoms depending on the blood vessel and the location. So our priority when you bring a stroke patient to Skyridge is that our wheels don't stop. We really try to move the patient to treatment as quickly as possible. We go from the launch pad to the CAT scan and then to the Neuro Interventional radiology suite to get the patient treated as quickly as possible. The average stroke patient loses about 32,000 brain cells every second. Reperfusion offers the best potential to reduce the extent of ischemic injury. Enter Skyridge Interventional Radiology. Our neuro-interventional team is available 24/7 to surgically remove these blood clots. Dr. Fry is one of our neuro-interventional radiologists, and he was interviewed recently for a Wall Street Journal article, and he said that thrombectomy is effective in reaching and removing a blood clot and restoring blood flow to minimize damage for the patient. Physicians typically have taken about 6 hours after symptom onset to perform a thrombectomy. But in February, the FDA approved a new device that gives the surgeons more time, up to 24 hours, to perform endovascular thrombectomies after symptom onset. Dr. Fry says that this procedure is extremely effective in removing blood clots that are blocking large blood vessels, and with this new device, he says we now have a larger window to help the people. He'll really do this treatment as long as there's salvageable tissue. Treatment at Skyridge, from diagnostic testing to confirming a stroke to completion of a thrombectomy, usually takes less than 1 hour. We can have a blocked artery open in less than 20 minutes with patients only needing light sedation. Thank you so much for your attention to this very important education that can mean greater functional independence to patients experiencing a stroke.